Did you see my email? Did you see my email, Wendy?
I just see it, yes.
Yeah, so if you were in the closing, would you mind just mentioning those people's names?
Sure. And does the closing stay in this session?
Yes, it does. Yes.
Okay.
Yes, it's all the same. So thank you so much.
Perfect.
Welcome, everyone. We're going to get started pretty soon. Go ahead and get settled. We're waiting on some of the other breakout sessions to wrap up. Please feel free to introduce yourself in the chat, and we're glad that you're here.
All right, we're going to give it just another minute. The last breakout session is wrapping up, and so we'll give it another minute, and then we'll get started. Hey, well, hello, everyone. Thank you so much for joining us today. I'm so thrilled to be the moderator for this session. I'm Wendy Neikirk Rhodes. I'm the interim executive director at Support for Families. And we're going to give it just a moment. If you need Spanish interpretation, that channel should be opening up.
Spanish interpreter here, and the channel is not open yet.
Thank you, Gabriel.
Thanks, Gabriel. Would you like to give the verbal instructions before I put you in the Spanish channel?
Sure, you have the slide?
Sure. It's rotating with the others. We'll get that up if you can verbal.
Si usted necesita servicios de interpretación, en la parte de abajo del panel puede encontrar el modo de accesar a la interpretación en cuanto sea activada. Usted va a encontrar un símbolo del globo terráqueo y ahí le puede dar clic o en los 3 puntos en el control de seminarios. Ahí va a poder escoger su idioma. En este caso sería en el español. Si solo desea escuchar en el español, selecciónelo y obtendrá acceso a la interpretación. Si necesita escucharlo solamente en inglés, por favor manténgase en el canal de inglés. Si está utilizando un teléfono móvil, va a encontrar los 3 puntos donde usted puede encontrar el acceso al panel de interpretación. Gracias.
Thank you. So today we are so lucky to have Yingjia Huang with us. She's the Assistant Deputy Director for Healthcare Benefits and Eligibility at the California Department of Healthcare Services. Yingjia, thank you so much for being here.
Thank you, Wendy.
She's going to talk today about the impact of the public health emergency, which is unwinding for children and youth with special healthcare needs and disabilities in California.
Great. Thank you, Wendy. So I could kick us off. Thank you again for the warm invitation, and I appreciate your time to learn about the redeterminations process in general. I think, as Wendy shared, the public health emergency has highlighted an immense impact to our beneficiaries across the state. And this unwinding of the continuous coverage requirement, it basically lifts the redeterminations pause that was put in place since March of in the department, and I think throughout kind of the chatter about healthcare relating to redeterminations in general is what we are coining as one of the biggest moments in healthcare. In terms, oh, go ahead.
Oh, I was just gonna say, yes, I agree. And I know it's estimated that over 2 million Californians might leave Medi-Cal due to this public health emergency unwinding. And that many of the flexibilities that were initiated during the public health emergency are gonna be rolled back. And this return to pre-pandemic operations will have far-reaching impacts for people with disabilities. And so I'm really interested to hear from you today what this redetermination process can look like, and where financial eligibility will be reassessed, and what the paperwork and process will be for that for families. Can you talk a little bit at a high level about what that process looks like? And then we can drill down more specifically into different aspects of it.
Yes, absolutely. So the redeterminations process for Medi-Cal will begin again on April 1st of this year. It has been paused or stopped for almost 3 years. So pretty significant amount of time have elapsed since then. And one of the most important things that will begin on April 1st is our county local offices across the state, all 58 of them, will be prepared to resume sending out renewals paperwork and processing the first batch of renewals. And the first kind of due date is June 30th of 2023. Now, that being said, just wanting to share kind of generally at a high level, the redeterminations process, or the unwinding, is a spread across 14 months. So it begins on April 1st of this year, and it ends May of 2024. So that's a total of 14 months, with April and May of this year being more of a preparation period to begin the mailing of packets. Now, that being said, they have our packets or our redeterminations actually is spread out across the whole 14 months. Not everyone will be getting a packet all in April and due in June. it will be spread out. And we are looking at making sure the redetermination strategy for families and our beneficiaries across the state are tied to mostly where their application month is in Medi-Cal. So that sense of familiarity in terms of when you expect and usually get your Medi-Cal packet prior to COVID-19 is probably around that same time. So we will begin our first kind of batch of renewals, and it will be for the June month, and then subsequently throughout the next 12 months through May of 2024. So our counties will all try to redetermine our families automatically first. It is part of their normal process in terms of making sure they could use all the available information, the financial information that you have provided through the data sources to the federal system to redetermine you automatically. In the scenario you aren't redetermined automatically, and we're looking at about 75% of our Medi-Cal enrollment or enrollees not being able to be redetermined successfully because of the time lapse, and the information does get old on your application, your current application, in comparison to a lot of the information reported to the federal government and the state government. So there will be an inconsistency in that that data is stale. And by that, then what the counties will usually do, they will actually send out a packet. Many of you may be familiar with a packet of materials being sent to you by your county office. And it will be done throughout from beginning in April through the course of May of 2024.
And so, Yingjia, I know many Medi-Cal beneficiaries have moved since March 2020 due to the pandemic. Given that this packet's going to be mailed out, how will they be able to be reached if the state doesn't know their new address, or what should they do if they want to make sure their most current address is on file?
Great, thanks, Wendy. So we knew that 3 years have gone by. The department actually has numbers in terms of, we estimate about 2 million of our enrollees may have moved throughout the state. And we're looking at California currently has about 15.4 million Medi-Cal enrollees, and about 2 million of them probably have moved about during the course of the pandemic. And knowing that, we throughout the last 2 years have really focused our outreach efforts in terms of pushing out the message, as Wendy, as you noted, updating your contact information, which is one of the most critical components of making sure that you're successfully renewed. So probably starting in May, in February, you may have seen Medi-Cal posters across the state where we advise our enrollees to, number one, log on to your Medi-Cal account on your county portal. You may, depending on which county you live, it will be a Benefits CalWin or Benefits Cal. Log on and see if your contact information is up to date. The most critical thing that we will need from you is making sure you have a good physical mailing address that we could reach you at, an updated phone number, because our counties will be sending that information to you. And we have tried to strengthen that message across the state. You will soon be hearing us and seeing us in visuals as well, and posters across the state in terms of advising our Medi-Cal beneficiaries to making sure your contact information is updated. Secondly, we have made our benefit, our renewals packet, our redetermination packet that will be sent out to you much more identifiable. It will be in a big yellow envelope. Previously, it was in a regular 8.5 by 11 envelope, but now we have procured it in a different color, just so that our beneficiaries, when it does come to you in the mail, our families are able to know that it's probably our Medi-Cal packet to you. Our counties have also been instructed to also contact our families twice once the packet goes out, by phone, by email, or by whatever preferred method of contact you have indicated, to make sure that you have received it and that you have questions versus not. And so we are really trying to not only do enough extensive outreach to wrap around that global awareness that that renewals are coming back, but also that your contact information is also updated. Managed care plans are also our partners, and you may be or have been getting messages from our health plans as well to advise you to also update your information. So all wherever we could have a point of contact with our families, we are trying to really push that message.
Sure. And then how are you identifying families who might need accommodations, whether they've requested alternative formats before or other kinds of accommodations that they've needed in the past for paperwork?
Yeah, so we actually rolled out in the last couple of years an alternative format to database where we have sent out mailers to all our Medi-Cal beneficiaries and our families in the last few years, requesting an indication whether they preferred a different type of format other than the normal correspondence, whether it be large print, braille, audio, electronic CDs, or a county, a person, or like an oral read through of the information. We have received responses across the whole Medi-Cal population and have stored it in a database in the state system where we have shared it with a lot of our across the whole DHCS kind of correspondence, just to make sure we provide to our families the most consistent format and that the one that you do prefer.
Sure. And then how does all of this impact families who maybe currently have a Medi-Cal waiver, like from their regional center, an income waiver? What does this process look like for them?
Similarly, you will be getting a lot of contacts from the waiver centers as well. In terms of the process for redetermination, we've been really outreaching to our DDS partners as well, just to make sure they are sharing the very consistent message. The key takeaway being really the first thing is making sure your family's contact information is the most up-to-date possible, just so that counties can reach you. And secondly, having that global awareness, that normal process that you recall prior to COVID-19 is now beginning again. So we definitely want to create a very consistent messaging downstream. So not only do our providers, but also across all our Medi-Cal populations understand that the unwinding has began and the continuous coverage is ending March 31st.
Sure. And how has the state moved forward with making sure that this is accessible in multiple languages or for families who need literacy support?
So across all our correspondence, in terms of our mailing, we always include a 19 threshold. Medi-Cal currently has 19 threshold languages, and we do include a tagline for various non-English speakers who may need potential assistance. That being said, that also includes the options for alternative formats that we have indicated, and that can be requested, and we have a very specific timeline in which to deliver that to our beneficiaries to make sure they have the adequate information that's specific to alternative formats. If it's for threshold languages, not only does the county have oral and kind of verbal communication, but also trained certified translators to assist with that, as well as DHCS, who also has trained certified translators to assist our families. And all our correspondence goes through Center for Health Literacy, and we make sure we hit the quality control methods and the measures that are needed in order for us to share this correspondence.
Sure. And how are you tracking families who may be missing who are eligible, especially for children who have complex medical needs or disabilities?
Yes, we are tracking this in partnership with all of our county systems. So we preemptively have, in a way, from a data oversight perspective, to look at disenrollment trends for different coverage groups prior to the actual discontinuance happening. So we have created quite a few contingency plans to make sure that regardless of the population, that we have a good kind of assessment before the actual disenrollment takes place, and for us internally to validate whether those disenrollments were valid versus not. And if they were erroneous, because we know there has been a time lapse in a lot of these business processes, DHCS is positioned to take action and restore all eligibility as quickly as possible to ensure none of this takes place. And from a long-term perspective, we have a pretty robust eligibility dashboard that we will be making public just for that transparency, that accountability, to make sure we are tracking this very closely to make sure there are no erroneous disenrollments occurring.
Sure. So if we are working with a family and they currently have Medi-Cal, what would you recommend that they do proactively to help navigate this transition?
We have created a main one direct stop webpage for all our families and really all our DHCS coverage ambassadors that have been helping us with this effort. It is www.keepmedicalcoverage.org. We are advising all our families to go to that website, sign up for email and text, and also from that web page to look at which county you belong in and which system you may belong, depending on your kind of system across the state. Log into your county portal, take a look at your contact information and to make sure it's updated. And also on that one-stop shop, you will be able to find a pretty comprehensive list of all the county phone numbers for you to call in the scenario that you're not able to log on to your county portal. And go ahead.
That's great. Thank you for sharing that. And I wonder, we will get that in the chat for you all in just one moment. And then you mentioned the ambassadors in there. Do you want to maybe touch on if there's any organizations here who are not currently ambassadors, what they can do if they want materials to help share with families?
Absolutely. So on our DHCS website, and I'll also put in the resource here as well in the chat, we have created since April, recruited many of our community members to join DHCS as a coverage ambassador. And within the DHCS local, the DHCS website, we have a pretty comprehensive toolkit of downloadable flyers, graphics, call center scripts, FAQs, and palm cards and different things for families here to download or organizations to download and share. And you could customize it with your organization's logo as well, and to disseminate and use for your needs.
That's great. And then what about families who don't have internet access? What would you recommend that they do?
For families who don't have internet access, I do recommend to give your county a call. And we do have a pretty comprehensive listing of all the county contact numbers, and to check in to make sure that the county has your most recent updated information as.
Sure. And then in terms of the call centers, if families need language support when they call, is that immediately available? Are there certain languages that's available in? What would you want people to know?
Yes, all translations are immediately available. All counties are trained. This is one of their first things that they're trained at in when they become an eligibility worker, is to provide oral translation or verbal translation to our beneficiaries who are on the line with them and are requesting translations. So they all have an ability and all have procured translation services that they could on the line almost immediately to assist.
Thank you. And then what should a family do if they are disenrolled during this process and they believe that that's not what should have happened?
Yes, in the scenario that is the case, the first thing family should do is immediately contact your county to get and provide the necessary, if there's documentation that the county is stating that they need, or secondly, requesting the county to review your case record immediately, because reinstatements are possible and it's part of a normal business process the counties are very familiar with.
That's great. I know our time is wrapping up, so I wanted to just give you a minute. Is there anything else that you would want families to know as they go through this process?
For all families to know that we are here to support. We are perfectly aware this is a process that many of you have maybe not done before or have not been doing for the last 3 years. But the biggest takeaway is please take a look at www.keepmedicalcoverage.org, sign up for email, sign up for text messaging. And in the scenario that is not an option for you, please contact your counties soon to verify that they have your most updated information, because once they do, they will have an ability to reach out and really assist you through the redeterminations process.
Wonderful, thank you. And then we have just a couple questions that I am trying to figure out how to access. So give me just a moment and we will have those. Here we go. Okay, so we have one question, which is there a way for enrollees to find out when they will get the packet so they don't worry that they haven't received it yet?
Yes, there is a way. You will have to give your county a call in terms of the redetermination month. The county should be able to tell you pretty quickly if you ask them about when is my redetermination month. They will be able to share this information just so you know when you will expect it in the mail. And for example, I'm going to give an example because there is like a time in terms of when you'll actually get it. If your renewal month is in the month of June, you will most likely be getting it sometime between April 15th to sometime in mid-May, because it does take some time for it to come to you. And then the due date to the county is always the last day of the redetermination month.
Thank you. Is there any financial support provided to organizations serving as DHCS ambassadors to families and Medi-Cal members?
Currently, there's no financial support for our ambassadors. We're really looking for you to assist us in all ways possible, so not at this time.
And then when logging on to the website that you mentioned, keepmedicalcoverage.org, we have a comment that says they don't see information for Medi-Cal contact info address changes. So they wanted to know if they were at the right place.
Yes, you are actually at the right place. That is more of an informational stop. And if you go to step 2, you'll actually be able to see the different systems for you to log on to the respective, depending on which county you're in, to log on to that county portal to verify your information.
Thank you. We have another question of, will the enrollment dashboard break down data by age, race, ethnicity, and other key criteria?
Yes, currently our enrollment dashboard will be breaking it down by race, ethnicity, and age. And more to come in terms of their other kind of data dimensions, but currently this is what we're kind of planning from a data perspective.
Thank you. There is some frustration in the comments about just how broken our systems are and how challenging they can be for families to navigate. And so I know that that's a sentiment that many of us feel. It's exhausting to navigate this, and this does feel very stressful. So we have one person who mentions that they received a renewal in December. And through a variety of different circumstances, it took them a while to get it re-registered. And they just wanted to know, was continuous coverage in place then? Because this doesn't change until April.
Yes, I could definitely speak to that. So number one, really acknowledge kind of the sentiment that Wendy shared among the chat. And I think we are really aware of this as a department and really trying to use the renewal campaign to make sure it's more seamless for you. We connect the dots much better as an organization. For the member that shared about their December experience, some counties across the state are still continuing sending out renewal packets through the pandemic. But what they are doing is they're only renewing based on positive. The continuous requirements were in place in December, so there should be no disenrollments occurring. Some of you may have been renewed during that time because we never stopped the auto process. What they were not doing was discontinuing anyone. So April is really when it returns again to where the adverse action could potentially occur if the packets weren't responded to or there were other changes that may make you not eligible for that.
Thank you so much for that. And then the last question is just where would a person or an organization find flyers and media brochures on the DHCS website?
Yes, I could definitely share that link. I put it in the chat immediately so that you can have all that.
Wonderful. This has been so insightful today. Yingjia, thank you very, very much for being here with us, for answering these questions and sharing about the process. I know that we all have a pretty high level of anxiety on what this is going to look like. And we're really hoping that the systems are improved and that the dots will be connected as it unfolds. But hearing just how we can proactively try to make sure our addresses are up to date and we get the information we need and where to reach our county offices if the process doesn't seem to be unfolding the way it should is very helpful and reassuring. So thank you so very much for being here.
Thank you so much.
Wonderful. So then I have the pleasure of also offering some closing remarks for today. Just please join me again in thanking Yingjia for closing out today with this keynote. It was just really wonderful to get to connect. I'm also just so happy to get to be here, even though it's virtual, to bring together all of our experiences as parents, as providers, as advocates. And I just want to say thank you to you all for being here. I know it can be very difficult to find the time. We're really happy you were able to join us today and look forward to more wonderful sessions tomorrow. I want to give an enormous thank you to our summit sponsors who make all of this possible. To our wonderful speakers and session moderators today, to our interpreters, to our behind the scenes tech crew, and especially I want to thank Pip Marks, who's the Director of Family Voices, and Nick and Tamika and the rest of that team, and the wonderful events coordinator, Holly Huang and her team. It really does take a village to pull off a virtual health summit like this, and just thank you so very much to everyone who has made today such a valuable and important time together. I have the wonderful privilege of announcing some of the door prize winners for today. So the $50 Amazon gift cards that were randomly chosen are for Maria Rodriguez, Caitlin Ashton, Carrie McKitty, and Inez Leonard. So congratulations to all of you. You'll also be receiving emails, but thank you so much for being here, and I hope you really enjoy those gift cards. Today's sessions were all recorded and they'll be available to watch on our website next week. You'll get the link via email. And then after tomorrow's closing session, you'll also get an evaluation survey. And we hope you'll take a few minutes to complete that and share your thoughts. Your feedback is very important to us. So thank you for being here today. I can't wait to see you again tomorrow, and I hope you have a wonderful rest of your day. Thanks so much, everyone.